that. Okay.
She married the man she dated before.
Good evening. I think we'll go ahead and get started so we have time to let Dustin answer all your questions and still have time for some small groups. If you don't know me, I'm Chris Bovis. I'm the bariatric coordinator for the program. Welcome. We have two support groups a month. The next one will be on a Saturday. It will be May 23rd, and it's from 11 to 12. So if you want to come back for that one, that's great. I like people to make at least one a month. And we do get sort of different groups of people at all of them because people work different schedules. So this evening, Dustin Huff, who is Dr. Hamilton's physician assistant, is going to answer any questions you have for him about bariatric surgery before, during, and after. And I may have to cut him off because usually people have so many questions that he would end up being here for an hour and a half. But he's always very gracious to come every year and do this for us. So welcome, Dustin.
All right, thank you. Good evening. How's everybody today? Got some rain, so that's good. All right, so just a little bit about myself. I'm Dustin Huff from Lawrence, born and raised there. Yeah. And I work here, so go Jayhawks. All right. Like Chris said, I work with Dr. Hamilton. I'm his PA. If you don't know what a PA is, it's a medical training, kind of similar to a nurse practitioner. If you've heard, a lot of people have heard of that term. So it's a 2-year master's program after your bachelor's degree, and we're pretty much trained general medicine, and then we can specialize or do family practice or whatever you want to do after. So I've been with Dr. Hamilton for 2 years now, and his first PA here, so he did not have one before he started here. Dr. Hamilton's Dr. Hohen's partner and Dr. Aragon. If you're Dr. Hohen's, talk louder.
Talk louder.
Okay. Got a mic?
No. Oh,
Okay.
well, I do have a mic. Would you like one?
I mean, can people hear me in the back, or do I need to just? You can hear me, okay?
Okay. I just
If you're Dr. Hohen's patient, then Tim would be the PA that you would see. So you'll get to know Tim if you're a pre. I don't know who's pre and who's post surgery. So anyway, tonight is for you guys to ask any questions you want. Last year, this is my second time doing it. Last year went very well, and people were very open. It took a little bit to get going, but once we got going, people, thought of questions based on other people's questions and answers, and so we just went that way. Chris did ask me to talk about one thing, and that is to address paniculectomies or abdominoplasties for patients after they've had weight loss surgery. That is something we do, and sometimes people don't know that we offer that service, but we do, and we have very good results. What that is to remove the excess skin off your abdomen. That's done after you've achieved maximum weight loss. So you want to make sure that you've got to the weight loss you want to and been plateaued for 5 or 6 months before we do that, usually, is what the doctors recommend. And so let us know if that's something you want to do. And that's a cash only. Did you want me to say how much it is? And all
Yeah, that's fine. That's
so it's
fine.
$5,000 to do that, and that covers everything: the surgeon's fee, anesthesia. That's done here at this facility on the 2nd floor as an outpatient surgery. And if you want to talk about that, I won't go into the details of how we do that, but I can if you want me to. So I'll let that be a question.
Is that a tummy tuck?
That is a tummy tuck, sure. Yep.
It goes all the way.
Yeah, from side to side. Yep.
That's
It's
the
a
only
one.
one you do, right?
What's that?
That's the only one you do.
That's the only one we do. Yeah, that's another question. Do we do arms? Do we do breasts? Do we do legs? No, we don't do any of that. And it also is above the muscle layer, so post-op pain is a lot different than somebody that goes below the muscle and removes that, so it's a lot less here, and we still have great results. So.
How long are the Jackson cuts?
Yeah, 2. You get 1 on each side. So the incision is from side to side with a drain on each side. You go home the same day. You come back a week later. I take out every other staple because the incision is closed with staples, and 1 drain as long as the output is appropriate. And then you come back the 2nd week and take the 2nd drain out and the rest of the staples. That's the usual scenario. So.
That skin, does that take this flab
Correct, yes.
They're-
So the layers of the skin are the outside skin,
Yeah.
then the subcutaneous fat, adipose tissue, then the muscle, fascial layer. So we stay above the muscle. We don't take muscle. We take fat. Yep. Take the flab too. Yep. Correct. Because you will get to a point after you've lost all your weight that you have more problems with skin irritation and pain because it hangs more and it hangs lower and it's not as taut. So you'll have more problems after you lose all the weight, and that's the time that we remove it. So I try to, in follow-up appointments, when I feel like people have got to their maximum weight loss, to offer that or to remind them, because we feel like it kind of it's a good complement or to a good end to your whole weight loss journey. So yeah.
Well, since we're on the subject.
Yeah, might as well just keep going. Might as well just keep going.
I had it done here March 25th.
Okay.
Why don't you stand up and twirl?
I will stand up because, and
It's awesome.
Dr. Hohen and Dr. Aragon did this surgery, so you have two surgeons that
Correct.
I guess they start on each side, meet in the middle, but
That's exactly what it is.
which
Yeah.
kind of, I thought, oh, well, I hope they're on the same
Yeah, what happens if they get to the middle and one's here and one's there?
But,
Markers. We use
I just
markers
want to
very
say
well.
they did a great job.
They did.
And the $5,000 is a huge bargain. And you can go to a plastic surgeon and pay twice that much. And the results were as
Phenomenal.
good.
Yeah.
And I had a lot of apprehension about pain and things like that, but it wasn't nearly as traumatic as I thought it might be.
Mhm.
And after the surgery, my husband talked to Dr. Hohen, and I said, well, what did he say? And he said, well, he said you'd be real happy with the results. And I said, well, what else did he say? He said, that's all he said. And I am real happy with the results.
Good.
I'm really glad I had it done, and my clothes fit better, and I feel better. And so when you get to that point, if you're considering it, I'll just say that my experience was really
That's
positive.
great. That's
And
good to hear.
just like the other surgeries here, I think these guys, all three of the doctors, I just couldn't be happier with my initial surgery, which was a year ago, and then the abdominoplasty, which was March 25th. So.
That's great. Thanks for sharing. Thanks for sharing. Yeah.
I apologize, I was a few minutes late.
Sure.
How long is the recovery afterwards?
As far as going home or like
No.
Okay.
Being able to return to work and,
with an abdominoplasty?
yes.
Right, we're still on
Yes.
that time. Okay. So normally, I mean, you're going to go home with 2 drains that are sticking out of you, and so I would say usually not for a week. I'd say usually a week off of work at least.
Well, it was 8 weeks for a cesarean, and I'm a massage therapist, and I
Uh-huh.
use my core a lot, so.
You'd be surprised at how fast you bounce back.
Really?
Yeah.
You'd be surprised. Cesareans go through the muscle layer. We don't go through the muscle layer. And when you don't go through the muscle layer, and of course I haven't had it, and you can speak to the pain afterwards, but most people say the pain afterwards hurts less than the laparoscopic surgery you had to originally.
Wow.
Are you cauterizing? I mean, I had it 10 years ago, so maybe it's different.
Yeah, we cauterize. Yep.
That was probably the most painful part of the healing process, which I found it difficult to sit, because I have a desk job.
Mhm.
It took me a good 5 weeks to get back.
Yeah, and I don't see that with our patients. So I guess it's just the technique used too. So.
I worried about all those things, and I borrowed a reclining chair because I thought I'd have to sleep in it. I did all this research online about the pain level and things, and I never used the recliner at all.
Yep.
And after a week, I felt pretty darn good.
Yeah.
And
Yeah,
even
surprising.
the first week, the level of pain was not nearly what I expected.
Mhm.
It was, I would say, for me, it was pretty much the same as after I had my gastric sleeve.
Sleep. Okay.
Wow.
Yeah. So.
Well, I was wondering, for me, I've already lost an awful lot of weight before I'm going in to have surgery, okay? And of course,
So-
I've got,
So you have had surgery? Have not?
I have not.
not, okay.
I used to weigh about 435 pounds,
Okay.
so, and just through diet and exercise got to this point. But my arms are like really, really loose and hanging. You know, I've got my wings.
Yep.
What can be done about that? I mean, I know that I'm hearing all kinds of things from different people. There's these rap clubs and different things like that where people are talking about stuff. But I mean, I'm sure there must be some sort of surgery that can be done for something like
plastic
that.
surgeons can take that off.
Okay.
What I've heard is that's the cost the most
Is it?
under the
Okay.
arms.
Okay.
I've not looked into that. I mean, to be real honest, because if somebody's interested in something where they want their tummy and arms and legs, then we just say go to a plastic surgeon.
Right,
So we
right.
do the whole thing at once. Okay.
Okay.
So I haven't really looked into it.
I just didn't know if that was even possible.
Oh,
You
yeah,
know,
it is.
'cause
Definitely.
some.
I keep my wings. Remind me.
Yeah.
So exercising won't help like the arms or the belly?
It'll help. I mean, it's gonna help some. It's hard to bring back the tummy skin. It just is. Because when you're exercising and doing core muscle work, you're doing muscle work. You're not really working on bringing in your skin. The doctors aren't really convinced that much about wraps and creams, and if you look out there, they've got several things that they try to get you to pay for that doesn't really amount to much. So removal is the best. So.
And I will tell you that next month, Stephanie and Robert McCain are going to be here. They've both had bariatric surgery, and they both wear something called Body Magic, which is a wonderful compression garment, and they both look fabulous. And they're just going to talk to you about that approach to some of the excess skin. So, as another option.
What's it called? Body Magic?
Body
you said?
Magic,
Okay.
yeah.
So it's just basically, it'll just hold things so that you,
Yeah,
so under your
exactly.
clothing it doesn't look so.
Absolutely. So you don't have those lumps and bumps.
Mhm.
So we could probably all use a little body magic.
I don't know, he looks pretty slim.
Well, not Dustin. No. He chases his 3 sons around. That's
That's
enough
true.
for him.
That's
Yeah.
true. My 3 boys keep me busy. So anything else on this topic before we move on? Yeah.
So when you say it's a cash, is it not covered by insurance?
We choose to not go through insurance.
Okay.
I mean, some plastic surgeons who use insurance, you have to have a lot of documentation, a lot of pictures. There's a lot of stuff to get insurance to pay for excess skin removal.
Well, yeah, because mine says that it covers all that up to a certain amount, but I'm sure you have to jump through a lot of hoops.
Correct, and we don't.
Yeah.
Yeah, we don't do all that. So,
Okay.
yeah, cash only. So, yeah. So that's kind of.
I had a question.
Yeah.
The thickness of your skin, does that have a bearing on how much it's gonna,
How much it's going to come back in, or how much we can remove?
yeah, that'd be loose?
The thickness of the tissue, I guess.
Well, like my skin on my stomach is
Yes.
thicker than my inner leg,
Correct.
and my inner leg, it's gonna hang, but my stomach seems like it's just coming back,
It's coming back nicer.
yes.
Oof.
I don't-
Um,
Does the thickness of your skin make a difference?
Not really, because as you lose weight too, the thickness of your tissue is going to be less too. You're going to lose adipose tissue in the thickness of your tummy skin too, so it'll get looser too.
I elected to have the sleeve
Uh-huh.
and haven't had it yet, but I went to my diabetic doctor today.
Okay.
And she said that she wanted to run a C-peptide, or peptide,
Okay. C-peptide.
to see if I was producing any insulin.
Okay.
And then if I wasn't, she didn't think I needed the surgery.
Are you type 1 or type 2 diabetic? Type 2.
And I've never heard that before.
Yeah. What's your A1C?
7.1.
Okay. And so what's her argument again, or what's her saying? What's she
Well,
saying?
She just wanted to know if I was producing any insulin.
Okay.
And I said, well, how do you find that out? She said, through this test. It's a blood test, but you have to fast. And she said, because if
be more of a type 1 diabetic, an insulin-dependent diabetic. Huh. That, are you Dr. Hohen or Dr. Hamilton's
Hohen.
patient? Have you met him with him yet?
Once,
Okay.
but I feel like I need to meet with him again.
Correct, based on that, because
Yeah.
I don't, and I don't think he'll buy it.
Okay,
I don't think he'll buy it, but yeah, I think you should still have the discussion with him.
okay.
So,
I will tell you, Dr. Hohen and Dr. Cerati, who's the bariatrician over here in this office that sees our patients in the hospital, they are speaking at a diabetic conference at Overland Park Convention Center, not this coming Saturday, but on the 16th. And they're going to be speaking from 3:30 to 4:30. And so you might want to attend that and ask them those questions, because I've never heard that either.
Yeah, I've never
I
heard
would
that.
disagree with that.
now it might be that they recommend the RMY instead of the sleeve, but I doubt it. I doubt it based on
She
your.
didn't mention any other.
Yeah. Yeah.
Well, I think the point, and maybe you missed hearing what she said, I just wanna clarify a little bit.
Yeah.
She ended with saying that the purpose of the surgery to get off the medication, if she's not producing insulin, you're correct. You'd become an insulin-dependent diabetic.
Correct. Yeah.
But if you are producing
Yeah,
an
because
amount
your
of
goal of
insulin-
having the surgery is weight loss and to get off insulin, correct?
Right.
Okay. And I think Dr. Hohen will argue that you will come off insulin and you will lose weight. Because we see it every day. And I bet if we did C-peptides on there, and I'm not gonna say, because I'm not familiar with that lab value, because that's not one we draw, and so I don't know
Okay.
about that.
That was another question.
Correct,
If
we
you-
don't do that,
Okay.
and so in that case, since we don't do it, it's not necessary. You know, I mean, we do the labs that are necessary. That's not necessary in our mind to decide whether or not you're gonna get off insulin and be done with
Okay.
your diabetes, so,
Thank you.
yeah.
And if you'd like to have a appointment with Dr. Cerati and discuss it with him, because he is an internist and also board certified in bariatric medicine, he's well versed in that.
Okay.
So
Yeah,
he
I'd
might
almost
be
lean,
helpful.
I'd almost lean towards him, and we have his business
Yeah.
cards in our
Yeah,
office.
I would be
rather
happy to
than Dr.
give you his
Hohen.
number.
Sure.
Okay.
Not that Dr. Hohen doesn't know, I'm just saying that Dr. Cerati is an amazing internal medicine doctor. So, yeah.
I'm a type 2 diabetic, and before I had my surgery, I was taking 5 shots a day, and I'm now just taking 2, so we will go off the insulin.
Well, that's what I'm doing.
Yeah.
Yeah, I took 6 shots a day, and now I'm down to 15 units a night as of.
I bet, yeah. And
Yeah,
that's it.
and it's got lower tonight because I keep going way below 100.
Yeah.
So,
Yeah.
Within 3 to 4 weeks after I had my sleeve surgery,
Mhm.
I was totally off my insulin.
Totally, yeah.
No, not even any oral medication for I'm type 2.
Yeah.
And my A1C has dropped down to 6.1.
Congratulations.
Get a hand.
Sadly, I think a lot of doctors just don't understand this surgery, nor do they understand the huge number of benefits that are
Correct.
derived from losing significant amounts of weight. I'm not a diabetic and I can't, speak about your doctor or even diabetes, but I just think in general, I went to doctors for years, telling them I know I need to lose weight, and they just were hesitant to recommend what I needed, which was to be here and to have this done. And I think they don't understand, or I don't know why. Because if it were fully understood, and if the doctors were recommending this the way I feel they should, there'd be lines outside the door here.
I just think you keep
surgery.
them in business.
Pardon
If you
me?
have diabetes and not having the surgery, you're keeping that doctor in business because you keep returning because you need their
Correct.
assistance.
And that's something we see too, with the endocrinologists and diabetes.
I hate to think that any doctor would
We hate to see
would
that.
do that, but
But-
yes, that is our experience.
Yeah.
I think most doctors go to medical college to help people, but they can only offer their patients what they have learned.
Correct.
sometimes, and I, correct me if I'm wrong, but sometimes a lot of medical colleges are hugely funded by the pharmaceutical industry, and so that is what they've learned. It's not that they just aren't versed in this surgery.
Yeah, and that's, you mean, you hit it right on, hammer on the nail. Yep.
Could you explain what A1C is?
It's a diabetes marker, so it is an average, it's a percentage of the last 3 months of blood sugars. And it comes out in a percentage, so.
And a lot of doctors, that's what I deal with, they think it's an easy way out. They think that this
Correct.
is an easy way out, that
Yeah,
you
really.
do the surgery, you won't, still won't eat right and everything, and it's just an easy way out.
Yep.
Well, they
It was
consider,
the hardest thing. Had mine done 5 years ago, and it's been the hardest thing of my entire life, trying to keep it off, and now I'm starting to gain some back, and it's just horrid trying to go back. So,
yeah, and I've
it's
dealt,
not easy. I've been fighting with food all my life, so it's not easy, but that's the way to think. I work at KU, I'm a nurse, and that's just the way people think. They think, well, you took the easy way out. What do you mean?
well, and that's because they think it's a moral problem, and it's not a moral problem.
Or a laziness problem.
Yeah,
Yeah.
there's a little more to it than that.
I've heard more horror stories when I told them I was having gastric bypass than I'd ever heard in my entire life.
I'll bet you did.
They were telling me, oh, you're gonna end up in ICU, you're gonna die. I'm sitting there going, what?
They ain't come here.
True, but
Everybody here gets gastric
my
bypass
surgeon
and
was
goes home the
very
next
good
day.
too,
Yeah.
So,
but
most,
yeah,
I'd say.
that's a big part of it too. People don't understand.
Yeah, and
That's true.
That's exactly right. And it's getting, the knowledge about it is getting out there, there's no doubt about it. I mean, we see that, Chris sees that. It's now part of the standard of care for family medicine. I think it's starting to be standard of care for anybody over a BMI of 35. So if family doctors aren't mentioning that, then they're doing their patients a dissatisfaction. They're not following the standard of care.
You were
And
in the office
that's
today,
changed.
you would have seen it was very crowded.
Yep. So, yeah.
I just wanna say to the people that are getting ready to do it, just remember, it isn't instant cure. There's a regimen that you have to follow.
Oh, without a doubt.
There is a diet you have to follow. And it's a totally learn how to re-eat. Don't do the surgery if you're not willing to do that. Because, I'm 2.5 months out, but
Still learning.
I'm still trying to learn what can I eat and slow down and chew.
Yeah.
I mean, that's like my biggest thing. Slow down and chew it and see how it works first and then
Yeah.
go for the second bite.
Yeah. Yeah.
Very true.
Maggie?
I'm also still in and I'm a year and a half out, so.
Yeah.
But it is important to do right now. I was curious, is it kind of a normal thing to go along and just like lose pounds for a long time, and then all of a sudden quit losing pounds but lose inches instead?
It is. I hear that all the time.
Oh, okay.
Yep. Yeah, you're going to go through plateaus. Those times drive people crazy.
Will the pounds kick back in?
What? And it'll start back up. Yep. Weight loss will start back up. So, what we tell people after a sleeve gastrectomy, your weight loss will take about 18 to 24 months to get to where it's supposed to be or where it should be. And with the gastric bypass, more of a 12 months to 14 months or so. So a little bit faster with the gastric bypass.
My surgery, it'll be a month on the 14th. And I have pain that comes from this side. Well, I've been mowing grass and stuff. And I
The left-sided pain. I bet everybody here. My most common phone call. Even though I've never had it, I can describe it up, down, left. I know exactly what that feels like.
It's
Normal. It's a pulling and burning pain on your left side. It's because there's a stitch below the skin on the muscle layer that we put because we have to dilate that side to either pull the stomach back through on a sleeve or put the large stapling device in on the.
It was a staple. He told me.
Yeah.
It's a
And the reason why your back hurts, I'll just kind of go into this, because everybody's going to, if you haven't gone through surgery, you're going to experience the left-sided pain.
Not everybody has that.
Okay, you haven't?
I
You
did, and people looked at me like I was, some people
Crazy.
looked at me like, what are you talking about?
Wow, okay.
Not everybody has
Not everybody does, but you will, you didn't have it either, okay.
Really? No, okay.
Well, the left-sided pain, the reason why is because that's the main side. So we have 6 holes. That's the main side we operate out of, or dilate to either pull the stomach back through on a sleeve to get rid of it, or put the large stapling device, which is about that big around for a Roux-en-Y. And we have to dilate that hole, and we dilate the muscle layer. And that's not the part that hurts. It's putting the stitch on the muscle layer to prevent a hernia from happening after. Okay, because we make that hole big enough. The stitch is what inflames the muscle layer and makes that hurt. So you'll feel a pulling and burning pain when you bend over or twist, and it'll feel like layers are ripping on that side, and that's all normal. That's all normal. The reason why the back hurts, how far out are you? Okay, so the reason why the back hurts on that side, now it will radiate pain all the way through, but people don't realize that you're splinting that side, whether you know it or not. I mean, you're protecting that because you don't want to cough, you don't want to laugh, you don't want to, twist just right in bed. So you're holding your back funny to protect that side and not allow it to hurt or strain. And so that's why your back hurts on that side.
Yeah, but mine's in the middle of my chest. I mean, the upper part. Where mine's being hurt.
We should talk.
It's like right in the middle of my shoulder.
Okay. And musculoskeletal pain this soon out is not uncommon. So.
Really? Phew. It's real bad.
How long does it last?
What's that?
The left side pain, how long does it last?
Hold on just a second. How long does the pain last? Some people use no pain medicine. Some people, I've had one patient tell me it took 6 weeks to go away. So everywhere in between. I have no idea to guess. I mean, normally by a couple weeks you're pretty good. If you do anything that stresses it, you'll set yourself back a few days. So, yeah, in the back.
Are the staples permanent? Are they stainless steel or titanium?
Titanium.
The titanium. They're always in there?
They're always in there.
So what happens? Does it like grow over?
Yeah, tissue grows over. So are you talking about the roux or the sleeve or both?
Sleeve.
Okay, so but all of them have the same staples. The sleeve, the big long staple line along your stomach, it'll kind of grow over. The fat layer that we cut away on the outer curvature of the stomach will kind of move back into place. It's amazing to go back in there and look on somebody that's already had a sleeve that everything's kind of put back into place.
Is that an issue when you go through a metal detector?
Nope. Nope. And no problems with MRIs or anything like that. No problem. Yeah. Yeah.
Is there a certain amount, like after you had your surgery for quite a while, is there a certain amount that you should never be able to eat more than? I mean, is there like an amount that you should never be able to eat more than this?
Normally we tell people 3 to 4 ounces of a protein at each meal. That's normally the amount that we shoot for. But your body will accept whatever you give it, really, to a point. And if you take one bite too much, and this is what I tell a lot of our patients that come in, I mean, if you take one bite too much, and you add that one bite to 2 bites next time, and 3 bites next time, I mean, your body will allow you to continue to eat more. Yeah. Yeah. So you got to be aware of that and make sure you're, concentrating on your portion size and eating slowly and chewing well. I mean, eating slowly is key because you eat too fast, you're going to fill up too fast and either not able to eat enough because it's going to get kind of hung up in there, or you're going to overeat and then all of a sudden get to where, oh, I'm full, and then you've taken 4 bites too much. Okay. Yeah.
Something I didn't notice in myself, but I learned in one of these group meetings is when you eat slow, a lot of times, I didn't know I was even doing this, but when you have this little burp, you're done.
Your soft sign. We call that your soft sign.
Yeah. And because it only happened a couple of times, but I took 1 bite too many and it came back up.
Yep.
Again, only a couple of times. But after I heard that there's the burp, and I'm like, oh. So if you're eating slow enough, you're paying attention and
Some people have the
you'll
burp.
know.
I've heard the hiccup, I've heard a sigh, I've heard a nose run. I've heard all that stuff.
It was several months out before I heard that here, and I'm like, oh, I knew that.
That's what that is. So listen to your soft sign. Yes, sir.
I thought I read or heard somewhere that you're supposed to get up to like 8 or 9 ounces.
With a meal?
Yeah.
Way too much.
Another protein food.
Yeah. Like with one meal, food, 8 or 9 ounces on a sleeve or bypass. That's like twice too much.
Really?
You should not be able to get up that
So
much.
if you add the meat, then you add your vegetable.
Uh-huh.
All that together would be 3 to 4 ounces
Usually 3 to 4 ounces of a meat source.
in a meat source. Okay,
Like a
then-
half a chicken breast, and I don't expect people to weigh it out. Half a chicken breast, a half a piece of fish, you know.
So if you add something else, that's gonna be more ounces.
Uh-huh. So 3 to 4 ounces of a good protein, but what we shoot for is getting the protein in first, and then adding to that extra. Yeah.
I think what I wanted to ask is kind of the same thing. What is the capacity of the pouch in fluid ounces?
Fluid ounces. That's hard to
I
tell.
mean, is it like 3 to 4? Is it 5? Like, what is a ballpark? Is that
2 to
really
3.
different?
2 to 3.
2 to 3 ounces, yeah.
2 to 3.
It depends on which month you're on too.
Yeah.
Yeah, I can fluctuate in it. The thing with fluid too is it flows right on through.
Yeah.
What I tell people about a protein shake diet. I don't like a protein shake diet after surgery as much as I do as a solid diet, because you'll find that you're hungrier sooner in between meals because it goes right on through like water does.
I just wondered, because I'm 2 months out, so I kind of wondered what the capacity was if you were eating something that wasn't necessarily protein, because everything is different. The water is different than the shake, than the solid. I just wondered what would be the capacity, the ballpark? Is it like 3 to 4?
Yeah, I would say it's 2 to 4, somewhere in there.
Yeah.
Yeah. Yep. Yeah.
My surgery was about almost 5 months ago.
Okay.
And I've been feeling great, exercising, doing everything, but all of a sudden, in the last 10 days, I dropped a considerable amount of weight. Don't know why, because I've been exercising all along, but all of a sudden, I dropped like 10 pounds in 10 days.
Okay.
And I'm flat exhausted.
Okay.
I mean exhausted.
Had you lost any before that? Had you been on a plateau or?
I've been losing on the average 2 to 3 pounds every week, and then all of a sudden it just whoa. And now I can't get out. I mean, I'm exhausted. Work is, I don't even want to go to work. I could lay right down here and go sleep, and I mean sleep. I'd be out.
And sleep patterns are still the same?
Yes, I'm still.
No medicines changed?
No medicine changed, nothing.
Vitamin intake?
If my
or
body
vitamins?
just said, wow, that was too much, and we gotta
Hard to tell.
rejuvenate or what?
That's hard to tell.
We gotta get through this.
Yeah, are you doing your vitamins?
Yes,
Okay. No change on those?
big honkers, 2 a day.
Okay.
Increasing.
Yeah, I mean, that could be one thing too, and we could check that level. When's your next appointment?
Not till August, because I was just in, blood work was great,
Blood work was good.
everything was great. It just,
It's been a week?
yeah.
Been a week, okay. I would just kind of wait it out. I wouldn't get worried about anything this soon.
Okay.
Okay.
Unless you need to check for mono. Could be something else.
Yeah, I mean, are you a sleeve or a bypass?
Sleep.
Sleeve, okay. I don't think it's related to the sleeve at all. This far out from surgery, I don't think it's related to the sleeve. So yeah, it could be several different things, viral illness, change in sleep pattern.
Don't feel sick though.
I'd just wait it out. Yep. Yes, sir.
I'm on omeprazole.
Okay.
And I had my surgery back in December.
December, okay.
Do I still need to be on it?
I like our patients to be on it for 2 months after surgery. And then as long as you're not having any problems, then you can taper off of that. The way I have, not have any problems. So the way I have people taper, because the reason why you need omeprazole, or why we start people on that after surgery, because a lot of people just stop it on their own, is it protects their stomach during those 2 months of healing. That's a big staple line you don't want any acid on. And so you want to make sure all acid is down. So that's why we start
off for like 1 a week.
So so what I tell people, and it's not an exact science, it's not like stopping a blood pressure medicine that you're gonna get rebound tachycardia or hypertension or something like that. I would, if you're taking it twice a day like you're supposed to, I would decrease to once a day for a week, and if you have no reflux, then I'd go down to once every other day for another week, and if you're having no problems, then stop.
Is it better in the morning or night?
I would take it in the morning.
In the morning.
Yep. Because that's when you're eating all throughout the day. Now, if you find that you wake up with heartburn and that's the only time you have it, then I would take it at night during your trial of once a day.
Okay.
Yep. Yeah, right here.
I want to talk about a smelly subject.
Smelly subject. All right, I'm ready.
I've been having a lot of gas.
Okay.
And it's different than it was before surgery.
Okay.
It smells a lot, it lingers.
Okay.
And I was told that there's a possibility I might have lactose intolerance.
Do you notice it after a certain diet or a certain food intake? Or notice it
No,
worse?
but what I was told was like there was a lot of things that I eat that I didn't realize that I was eating that has like milk and stuff that's in it.
Never had problems with milk before?
I never had it before.
Some people do develop a lactose intolerance after. My other question is, do you have any abdominal pain with it, or nausea, or?
No, the only pain that I have that comes with it is like if I'm around people and I'm trying to hold it in.
Well, at least you're trying to hold it in. I think that's.
But that would be my next question. Is there anything that I can take that would help with that?
There is a lactose intolerance medicine you can take before taking something that's lactose, and you can find that over the counter at the pharmacy. You can ask the pharmacist for that. I can't remember if it's Lactaid, or I think is the name of it. It also can be indicative of gallbladder problems after surgery. I've had one patient that I couldn't figure out what was going on, and mainly it was that type of complaint. And we tried the Lactaid, and it didn't work, and we decided to work up her gallbladder, and it was that, and so we took her gallbladder out. That took care of it. So a lot of it's not surprising at all after weight loss surgery to have gallbladders that go bad, so we do a lot of gallbladder removals. So if you're ever experiencing right-sided abdominal pain, nausea half an hour after your meal, that's not normal. You should tell Tim or I, and we'll work up your gallbladder.
Can they take Gas-X? Will that help? Any simethicone thing is okay?
Yeah, Gas-X is good.
Okay.
Take it before your Beano is another thing you can take before your meal. First I would try to pinpoint what you think causes it. I would eliminate some things and see if it goes away, like eliminate dairy and see if it goes away, and if it does, then you know it's dairy after you restart it back up. And if you want dairy, then you can try Lactaid and see if that takes care of it. So. Yeah.
On the gastric bypass, can you stretch that out?
Sure. You can stretch any of them out. We do revisions a lot, so I can answer questions about those. We're probably the only we're the only place in Kansas, I think, that does revisions, or we're the top for revisions in Kansas. So we do a lot of them.
What's a revision?
A revision of your gastric bypass.
Oh, okay.
So what does that entail? That entails going in and decreasing the size of the pouch.
Oh, wow.
Has anybody had a revision in here of Roux-en-Y?
I went from a VBG to a Roux-en-Y.
Okay, VBG to Roux-en-Y. Okay. And you had?
I had it was called a Mason shunt.
Oh, Mason shunt. Okay.
Back in '79,
okay.
And they didn't test it to the stomach.
Okay.
So they had to okay.
So with revisions of Roux-en-Y, the first thing is that people realize. I'll kind of start on this because I know we've had some questions about revisions in our office too. But with revisions, the question of whether or not I need a revision is: are you gaining weight? And if you are, do you feel like you're able to eat more than you were when you first had the gastric bypass? And if those are yes and yes, then the first thing I would do is come see us, and we'll schedule you for an EGD to go in there and look at the size of the pouch. It's really the only way to tell. It's pretty common for patients that have had gastric bypass 5 years or longer to have a pouch that's too big, because we make pouches way smaller now than we ever used to. So if somebody is a candidate for a revision, what that entails is just making the pouch size smaller. You're not going to see the dramatic weight loss that you first saw with your original gastric bypass, though. And we've had a lot of patients, or not a lot, but we've had some patients come back that have had revisions, frustrated that their weight loss doesn't fly off like it did the first time. And the reason why is because with an original R&Y, you're going from a regular sized stomach and normal intestines to a small pouch and 100 centimeters of, diverted bowel for your malabsorptive component. The malabsorptive component of the Roux-en-Y lasts for about 6 months or so. Okay, that's why you see most of your dramatic weight loss with a Roux-en-Y the first 6 months, and that's why you should be most diligent with your exercise and diet and all that stuff the first 6 months, because you're going to see most of your weight loss then. So when you come back for a revision, we go in, we take that small pouch and we make it a lot, smaller, but it's not from big to small, it's from small to a little bit smaller. And we don't change the bowel at all. So you're not going to get the malabsorptive component. You're just going to go to a less quantity that you're able to eat. So that's why people sometimes when they come back, they're upset because the weight isn't flying off like it did the first time, and that's why.
They changed my bowel.
What's that?
They changed.
Well, because yours is different.
Because mine wasn't the Mason shunt. They didn't do that back then.
Yeah, that's a different surgery.
Because my weight is coming off really good.
Yeah, that's great. That's great.
What about the sleeve?
Sleeve what? Revise the sleeve?
We don't do that.
Usually we go from a sleeve to an R&Y. To a Roux-en-Y, gastric bypass.
Oh, really?
If you need it revised.
Wow.
Now we can, I'm trying to think if we've done a revision of a sleeve. Have we done a revision of a sleeve, Chris?
I think we've only done one, and it
One?
wasn't because it was too large. There was other reason, I don't remember.
It wasn't
was an
too
ulcer
large,
or
okay.
something like that. Yeah.
I remember thinking Dr. Hamilton and I were going to have one.
Yeah.
I mean, if it's big enough,
Those don't seem to enlarge as
Yeah.
easily as the room one.
yeah.
How much is a revision?
You mean self-pay or like insurance? I don't know insurance prices. I mean, normally insurance pays for revisions.
They do? They do. I didn't think they would.
Probably
Not all.
Depends on your insurance.
Depends on your insurance. Depends on your insurance.
Yes.
But I'd say, most.
Most of ours seem to be.
Yeah, most of ours seem to pay for it. So,
And
yeah,
that-
in the back.
I know I had the lap band first.
Okay.
And then I had problems with it, so I had to take it out.
Take it out.
And then I got the Roux-en-Y.
Roux-en-Y,
And I found out that my insurance did not cover it because I have United Healthcare and it says you're allowed one weight loss surgery in
Yes.
your entire life.
Oh, okay.
Yes.
So just kind of a.
So yeah, it's definitely by plan.
Who you have, so.
And it's not even by who you have, because most of the insurance providers, all the names, cover bariatric surgery. It's that each individual plan does not cover it. So that's the thing. So some patient says, I have Blue Cross, they don't cover bariatric surgery. Well, your Blue Cross doesn't cover bariatric surgery.
Your company.
Your company doesn't.
Yeah.
It's what your employer chooses to pay.
I chose to pay.
One,
So
yeah.
for self-pay, what would it be?
The same as the
same as
original.
the price as the original bypass. So, yeah.
If you, when you do an EGD and you see a hiatal hernia in there, will you take care of that at that time?
We will fix that at the time of surgery. And sometimes, even if we see a hiatal hernia on EGD, it might not be a hiatal hernia that we see inside, or the other way around. Or it might not be one that's fixable or too small. Or what a hiatal hernia is everybody has a hole in your diaphragm. Diaphragm is the muscle that contracts to allow your lungs to expand so you can breathe. There's a hole so that the esophagus can go down through the diaphragm and hook up to the stomach. Sometimes that hole gets too big That's why people have reflux sometimes, or problems getting food down, food getting stuck. And so we will take care of making that hole a little bit smaller. And that will do it at the same time as your surgery. And if you're a self-pay, we'll do it. If you're a self-pay sleeve or a self-pay bypass, we'll still fix it. We won't increase your fee or anything like that. We do that for free on self-pay. Yes?
Regarding the acid reflux, I was on the
Omeprazole?
Yeah, when I first came out, and then my insurance at that time was, the prescription was, the insurance was different. So I went to get a refill.
Okay.
And they denied it because I'm in another prescription, which is Caremark. Anyway, I had the doctor, they said I had to have 90 days prescription.
Okay.
In order to get it. Well, my doctor sent it, well, they still denied it because he has to call Caremark. But anyway, I'm having acid reflux now.
Okay.
Sometimes I wake up at night.
Okay.
With it.
Okay.
And I didn't have this prior.
When was your surgery?
In December, but I'm starting to get that acid reflux.
December of December of 14? Okay. And you said you're off of the omeprazole, or you're on?
Yeah, I've been off of it for some time, and I'm starting to get the, because I didn't get it refilled.
Okay.
But
No problems getting food down. You don't have pain.
I don't have pain, but I can't eat very much. It wants to come back up.
You get nauseated when you eat?
Yes, sometimes.
Right away? Or?
Not right away, but maybe after about 5 bites, I start getting.
But you can get solid foods down?
I can get it down, but I start bringing up foam.
You do?
Yeah.
Okay. Are you Dr. Hohen's patient? Okay. So you need to come see Tim.
Okay.
So you need to get started back on the omeprazole.
Yes.
Okay. And there's a question of whether or not you'll need an EGD. Okay. What that could be is either a strict, are you a Roux-en-Y or a sleeve?
No, sleeve.
Sleeve, okay. So what that could be is irritation of the pouch. And we might need to put you on a medicine called Carafate to heal that irritation. But either way, you need to get back on your omeprazole.
Yeah.
So.
You can get it at Costco.
Correct, and you can get it over the counter.
I
You-
know I can just get one on the
Yeah,
counter.
it's the same dose over the counter, 20 milligrams twice a day.
Oh, twice a day, okay.
Mhm. Yeah, sometimes it's cheaper for patients to get prescription versus there's no difference in the strength or the kind.
Yeah, well, 90 days costs $89.
Yeah, that is expensive. Wow. Yeah. So I'd get started back on that if your symptoms don't get better. Because it's not normal to have foaming or after you eat, as long as you're eating slow, chewing well, small bites, all that stuff. If that doesn't get better, then you need to come see Tim. Okay? Yeah. Uh-huh.
Why, when you do get sick, I've gotten sick a couple times, why is it never the food that comes back up? It's just the phlegm?
Are you lucky? Are you a Roux-en-Y or a sleeve or sleeve? Yeah, I don't know exactly why that happens, but that's normal.
Okay.
Yeah, that it's not food, but it's sliming type. Yeah. Very common with band patients too, to get that.
When you talked about the needing a revision, on the sleeve, what are the percentages or what are the odds of it actually being stretched out? I thought it was pretty unstretchable.
Yeah, it is, but I mean, patients, if you try hard enough to stretch it, it will. I mean, your esophagus can dilate. The sleeve is only a muscle; it can dilate.
Is there like a percentage of ones that do, or is it pretty?
And we don't track that, and we don't really do EGDs a lot on sleeves to look at size. So
you don't have it happen very often?
no, it does not happen very often. And usually the Roux-en-Ys that need a revision or have big pouches is because their pouch was made years ago when it was made bigger. So, or somewhere else where they make a different size pouch, usually.
Or they went back to drinking soda pop. Carbonation is the single biggest reason we see it stretch out. The carbonation, when it hits the stomach, the carbonation is heated in your stomach and expands. And it can really, if you do that enough, it will stretch your pouch right out.
Sleeve and pouch?
Not so much the sleeve, but I see it with the with a pouch all the time.
Well, very good topic. That's, I was just curious.
Yeah.
How do you determine what size of pouch that it's made? My daughter had it, and I had it, and.
You feel like you're different,
Yeah,
different
right
size
over.
pouch.
I can eat a whole lot more than she can.
Early you're out, 6 months out, I'm still in she can.
You don't need as much as she can?
Yeah, I don't.
Yeah, we use a sizing balloon, but we also, and it depends on the it depends on the time, if I could remember. I don't know, are you Dr. Hohen's patient? Or
No, both
Dr. Hamilton's? Both Hamilton, okay, I should know you then. I
have
recognize
to
you.
see you tomorrow.
Okay. I do recognize your daughter. So we use a sizing balloon that holds 20 cc's of air, which is about the size of an egg, a large egg. That's about what we use to size your pouch. However, we have to take other things into account when we're making it that size, like the vasculature, like a blood vessel. If there's a blood vessel tracing right across where we want to make our first staple line, then we kind of have to adjust that a little bit. Usually not. So there's surgical variances based on the size of the pouch too. But we shoot for the same size based on that sizing device. Same with the sleeve. Why we use a 34 French bougie for everybody, but some people have a bigger sleeve after. It's all in your anatomy. Your anatomy kind of dictates how well we can do the operation. As does the liquid diet pre-op. I'll go into that little tangent. If you're pre-op, you got to do your liquid diet.
I never want to do that again.
As painful as it is. Painful as it is. We know when you don't do it. Yeah. So, the reason why the liquid diet is so important is because it makes it so that we can do so when we don't do the liquid diet, your liver's big and your belly wall isn't softened so that it moves when we move our instruments. If it's rock hard, then every time we move one instrument, everybody's instruments move. And so we have to change from doing, and this is, I hear Dr. Hamilton saying this in my ear, every time we see somebody that doesn't do it, and their liver's big and their belly wall's hard, is that we have to go from doing a perfect operation to doing a safe operation. And you're not going to get the best operation that you would have. And I know it's painful. It's a painful 2 weeks or 1 week or whatever you have. But it's important so that we can do a perfect operation, because that's what we shoot for every time.
It's good mental preparation too.
Correct.
Once you get to about day 4, like something clicked on day 4.
You're like, oh,
with me,
I can do
and
this.
then it's like, okay, you got through the hardest part. And really,
Yeah.
the first 4 days were harder than probably recovering
Yeah.
from surgery. Those first 4.
Yeah.
I mean, seriously,
Yeah.
that was hard. So.
Yeah, it's a hard 1 or 2 weeks, but
Okay, prior to this, well, after you have the surgery, you can't have caffeine. But then they say you can have it like 8 to 10 weeks.
8
after.
weeks. 8
Well,
weeks.
I've been drinking coffee.
okay.
I don't know, I've been drinking like a large McDonald's cup Monday through Friday, but is that bad for you?
Might help your acid reflux if you didn't drink coffee.
Yeah, it is acidic. Laura would tell you that caffeine can stimulate hunger,
I don't get
right,
that. I don't get that.
Laura? So that's why we say to decrease caffeine. I don't know if I'd shoot for a large. Yeah, I can.
At 8 weeks, I guess you can.
Yeah. Any other questions about surgery or post-op or what we do? Or I'm up for anything.
Well, we need to have a little time so people can get into their small groups. So I thank you very much.
You're
I've been taking notes, and